Nuclear medicine is the study of the function of organs. What we do is we inject a radioactive medicine into the blood, and then we're able to image the organs and how they work and how they function.
I love the fact that I work with people. The patients we actually get to spend time with, whereas when you're working with X-ray, you take them in for a very quick X-ray and hold your breath, okay, breathe, you're gone. This way, our procedures take time. You get to talk to the patients. You get to teach them what you're doing. You can tell them about their procedure.
I chose nuclear medicine because I really enjoy physics, imaging, diagnostics, which is taking the pictures, as well as working with the patients. And this really incorporates all of those things together.
On the day of my studies, I usually do a quality control, which is basically going to our machines, making sure all the machines are working properly. Then I go with my usual job, interview the patients, get their history, and perform the exams. At the end of the day, I collect all the information I do, enter it in a computer, do my wipe down, make sure everything's still proper, no contamination.
I think the most important thing is you really need to be flexible and quick on your feet. There are many ways to do different scans, but you need to be able to work and assess the situation.
Communication is very important. You need to be able to talk to all different kinds of people, doctors, patients. You need to have some computer background, of course a good science background, anatomy, physiology background. Sometimes, believe it or not, organs are not in the exact same spot in every patient, so you have to try to figure out, is that what I'm looking for or is it not?
Well, what makes my profession different is that we get to play with a lot of technologies. Right now we're in the forefront of fusion imaging, which is combining CT with nuclear medicine, MRI with nuclear medicine.
Well, I've always enjoyed what I do, and I think it probably is more because of the closeness that you can have with your patients. You have a real rapport with the doctors that you work with also. And again, you work with cardiologists and oncologists and radiologists, so you work with a real gamut of people, and you do so much good for the patients.
We did a WBC scan, that's a white blood cell scan. We tag the blood cells of the patient and we re-inject them. So we're able to see where that tracer goes. They did not know what was wrong with this patient. This patient had a fever and couldn't figure out what was wrong. And this was able to identify infection that they were unable to see with other diagnostics. I mean, really, it could have saved the patient's life. And that really made me feel good. And we really took part and helped, save that patient.
I think because we deal with so many oncology patients, cancer patients, you can see them through different stages of their initial diagnosis. You see them as they're going through their treatments, and to be able to see a person who you knew was very ill and to see them walking around and living their life and living a good life after their treatment, you really feel a part of that.
Well, for people that are interested in technology and science, I think it would be really very interesting for them. It pays well too, so you have all the benefits, really. It's a great field to be in.